Hello everyone, welcome to my channel Guide Dental. This is Dr. Saib Singh. So the topic for today's video is going to be general surgery. This is the second part or the second video for the subject. Whatever topics I'll be discussing in my video are also mentioned in my blog by the name of Guide Dental, the link for which is provided in the description. Now coming on to the topic of diathermy, cryosurgery and laser. In diathermy you need to know about its basic principle, that is the voltage used, uses of diathermy, monopolar and bipolar diathermy, their indications and disadvantages, only these two things. In cryosurgery, you need to know about the definition, mechanism of tissue destruction, methodology, that is nitrous oxide and Joule-Thomson effect, liquid nitrogen and the specific temperatures, and the uses of cryosurgery. In lasers, you need to know the full form, that is light amplification by stimulated emission of radiation, types of lasers, advantages, disadvantages, uses and precautions. This diathermy, cryosurgery and laser is asked cumulatively as a short note for 4 or 5 marks, usually. Now coming to the next topic, that is cervical, tuberculous, lymphadenitis. You need to know the basic introduction of microbial etiology in brief. The clinical features, that is stages of CTL, that is cervical, tuberculous, lymphadenitis in detail. Do mention about matting of lymph nodes as pathognomonic sign. Study other clinical features also in each of the stages, but you have to do the matting of lymph nodes as a pathognomonic sign. Don't forget to mention this they might ask you in your viva also. Coming to investigations, you need to know wedge biopsy, FNAC in brief, only 1 or 2 lines in each of these two will do. In treatment, you need to know the flow chart in which treatment is given according to the stage of CTL, so that flow chart you need to know, that's it. Next topic is epulis or gum boil. This is 99% asked as a short note. So you need to know the definition, types, study about the histopathological presentation for all the 3 types, and treatment only study for the carcinomatous and giant cell epulis. That's it. You need to know an MCQ or a viva question, that is pregnancy epulis is also known as gingivitis gravidarum, which is a granulomatous type of epulis. So this is asked as an MCQ, so this you should know. Next is cellulitis. You need to know the definition, microbial etiology, sites, clinical features, treatment in brief 1 or 2 para, complications 2 to 3 names, that's it, and differences between cellulitis and abscess. This, if cellulitis is, if you are running short of time, you don't know what to add, you forget something, so this is something which you can add to at least get your passing marks in the exams. Carbuncle and erysipelas. Carbuncle, you need to know the definition, etiological microorganisms, site, clinical features, mainly mention about sieve-like cribriform appearance and red hot coal appearance. Then the treatment, you need to know about cruciate incision and related surgery of cruciate incision in detail. Then the complications, you need to know only 2 complications, that is septicemia and toxemia. Erysipelas, you need to know the definition, microbial etiology, clinical features. In clinical features, do mention about rose pink rash and millions ear signs. So these 2 clinical features are very important in erysipelas. Then the treatment, complications, you need to know about septicemia and toxemia once again. Next is actinomycosis. You need to know the definition, microbial etiology, types, only the names of the types. Cervicofacial actinomycosis, you need to know in detail. So in this you need to know the predisposing factors and clinical features in detail. Then the treatment of actinomycosis, you need to know only in brief. Syphilis, you need to know about the synonyms of syphilis, that is French disease or great pox. Then the microbial etiology, stages of syphilis, you need to know the names and clinical features of each stage in detail. Do mention about snail tract ulcers, gamma and Hutchinson's triad, in whichever stage these clinical features are found. So these you need to know in detail. Investigations of syphilis, only the names will do. Treatment in brief, you need to know only 2 to 3 points or 2 to 3 lines will do. Next is HIV or AIDS. In this, from surgical point of view, the rest is discussed in general medicine, what you need to study. In general surgery, you just need to know the universal precautions taken in the surgical wards or the operation theatre in case of HIV AIDS. So you need to know the universal precautions taken in OPD as well as in the operation theatre, and the risk of transmission of HIV to surgeon. This is statistics you need to know, 2 or 3 points will do. The next topic is lymphangioma or cystic hygroma. 90% asked as a short note. So here you need to know the basic definition and concept. What is lymphangioма? And when is it called as cystic hygroma? So that you need to know in the definition. Then the typical sites of different types of lymphangioma you need to know. In clinical features, only mention its physical examination characteristics. Only that particular thing you have to describe in detail. For the treatment, you need to know the surgical excision in detail. For complication, any one or two names will do. In ranula, the definition, you have to mention the definition, of course, the whole definition, but make sure to mention about its origin and why is it called as ranula. That is important. Etiology, only explain the etiology related to retention cyst mechanism. Then the clinical features you need to know in detail. Do mention about plunging ranula and cross fluctuation test. These two clinical features are very important. They might be asked in a Viva also. So make sure to mention these two clinical features in your answers. Then the treatment, you need to know only that it surgical excision, only the name will do, and marsupialization you need to study in detail. For differential diagnosis, you need to know only one, that is sublingual dermoid cyst. Explain that. One para will do. The next is asepsis, sepsis and antisepsis. This you just need to know the definitions of the three. That's it. In trigeminal neuralgia, you need to know the synonyms. Definition according to IASP 2004. Only that definition, that's the easiest and the most frequently used, so that you need to know. In etiology, you need to know the intracranial, extracranial causes, any 3 to 4 causes in each of the subtypes. The history, that is pattern of pain, crescendo decrescendo pattern is seen in trigeminal neuralgia, so explain that in your history of patient. Clinical features you need to know fully in detail. 8 to 10 clinical features are sure to be mentioned. Then in diagnosis, you need to know the SWEET diagnostic criteria for sure. I mean, you can study other diagnostic criteria also, but SWEET diagnostic criteria is the easiest, and you can remember that easily also in your exams. In treatment, for treatment, there is a chart given for treatment of trigeminal neuralgia in Nilima Malik book for oral surgery. Just you can copy and paste that chart. That is more than enough. All the necessary medicines and surgeries are mentioned in that chart. For differential diagnosis of trigeminal neuralgia, only 3 to 4 names will do. Thank you so much for watching the video. This is the end for the second part of general surgery. If you found this video to be useful, please like, share and subscribe to my channel Guide Dental for further updates. Thank you so much.